Restoring your mouth with implants and a dental bridge is accomplished in 2 phases. The first phase of the procedure is the surgical placement of the implants. They're under the gums for several months while the bone attaches to them. After healing, the second phase begins. The implants are re-exposed and your new teeth are made. For the surgical placement of the implant, your mouth will be numbed. An incision is made in your gums, and a channel is made in the bone to receive the implant. After the implant is snugly in place, the gums are closed over the implant with a stitch or 2. Over the course of the next few months, the implant becomes securely attached to the bone. The second phase starts with surgical exposure of the implant. Another incision is made in your gums, and a small extension is placed to bring it above the gum line. We then start a series of appointments to make your new teeth. Though some of the steps might be different in your case, they usually include making impressions of your mouth. From these impressions, we make precise working models of your mouth, which are carefully mounted for proper alignment. The last step is the placement of the bridge. The success of your implants then depend on your care of the implants at home and our support through regular checkups and cleanings here in our office. In the past, one of the disadvantages in using implants to replace a missing tooth has been the long waiting period of many months. First, the wait for the bone to heal where the tooth was removed. And second, the wait for the implants to securely attach to the bone prior to placement of a temporary or permanent crown. Fortunately, new technological advances and techniques now make it possible, in many cases, to place an implant and a temporary crown, both on the same day a tooth is removed. Restoring your mouth in this way with an implant involves several phases. On the first appointment, after making sure you're completely numb, we remove the tooth. We then make a channel in the base of the extraction site or reshape the extraction site to receive the implant. An extension is attached to the implant, and we then fabricate a temporary crown, which is cemented in place over the implant, or attached to the adjacent teeth. We carefully adjust the temporary to make sure it's not hitting when you bite together. Over the course of the next few months, we advise a soft diet and ask you to avoid chewing on the temporary crown. It takes several months for the implant to become securely attached to the bone. The next phase starts with removal of the temporary crown, followed by a series of appointments to make your new permanent crown. Though some of the steps might be different in each case, they usually include making impressions of your mouth. From these impressions, we make precise working models of your mouth, which are carefully mounted for proper alignment. It's on these models that your crown is fabricated. The last step is the placement of your new crown. The success of your implant then depends on your care of the implant at home and our support through regular checkups and cleanings here in our office.